Just 48 hours removed from when United Healthcare CEO Brian Thompson was gunned down in New York, and that massive manhunt is still underway for his killer in what police are calling a calculated and premeditated attack. In a new statement, the United Healthcare Group says this, quote, "While our hearts are broken, we have been touched by the huge outpouring of kindness and support in the hours since this horrific crime took place." But this killing has generated a very different reaction from some on the internet. Just take a look at some of these comments found under a CNN video about this story online. These are just a few, among dozens of hateful comments that we found, including one saying, quote, "Sorry, my sympathy is out of network." The New York Times writes this, quote, "The dark commentary after the death of the 50-year-old insurance executive from Maple Grove, Minnesota, highlighted the anger and frustration over the state of healthcare in America, where those with private insurance often find themselves in Kafkaesque tangles while seeking reimbursement for medical treatment and are often denied." And that frustration is something that doctors say they've seen from patients throughout their careers.
I see people when they're at their lowest, when the system has failed them, and I'm frankly not surprised. They feel abandoned, they feel exploited, they feel lied to when it comes to the healthcare system, and especially insurances, because of the things you mentioned: denials, prior authorization, narrow networks, the cost of healthcare. It's been going on and bottling up for a long time.
So our panel's back. Annie Linskey, we're going to be clear here about the tragedy that is Mr. Thompson and his family, right? And set that aside. But what we do see in the wake of this is an outpouring of anger around the way people have been treated by these companies. Now, we're again going to be clear. We are not saying that this justifies any sort of violence at all. But this conversation has really exploded. I mean, my family's talking about it.
Absolutely, mine is too. I mean, of course, vigilante justice is not the answer to the problem. But what I should say is, and this incident and the reaction to it ought to be a wake-up call to this industry, which has, there have been many big, really good investigative pieces about United Healthcare in particular, and the issues that their customers have in getting the healthcare that's promised, getting the responses promised. And if it's not it's not a wake-up call to the industry, it certainly will be to Congress, and they are going to have there will be laws.
In a CNN story that was just published about this, they note that a Facebook post that was put up by United Health Group expressing sadness about the CEO's death, it received 62,000 reactions. 57,000 of them were laughing emojis.
I mean, that's sad to think about, but look at this. I mean, and you're right. Most of these healthcare issues are life or death. And I have a sick dad home in Louisiana, and we go to the doctor all the time, and sometimes we get denied for things. And it doesn't feel good, And so I think people have a personal issue with the way their healthcare has been administered. And I think, to your point, Annie, over the next few weeks, few months, we're going to have a conversation about this. If Congress has to take action, I think they will have to, but we hope that these private companies can come to the table and be a little bit more consistent in the way they administer healthcare. I think that would be helpful.
United Healthcare has already been the focal point of ire for Congress because it's vertically integrated. They're buying up doctors' offices. They own the largest PBM, which controls the price of prescription drugs in the country. They're the most aggressive on denying claims. I think United Healthcare will get more scrutiny.
And of course, we don't know the motivation yet of this killer. We just know that these two words were found on these bullet casings. But Elliot, this is something, the fewer means you have, the harder it is to fight back against some of this stuff. And it is something that happens, it seems like this is a universal experience for people.
And I agree with everything that's been said here. This is exposing a frustration in the public across income levels. I just think, just to state the obvious to some extent, Casey, this is as much about the internet and how the internet has broken us as a people. Most of the people putting those laughing emojis and responses would never look this person's wife in the eye and make those things, no matter what kind of problems they might have with how United handled their health care. And that's really, to me, what this is all about.
It's coarse. Very coarse. Very coarse.
The killing of CEO Brian Thompson has struck a nerve in this country. I mean, have you seen some of the stuff people have been saying online? Is exposed just how angry folks are at America's healthcare system. Just a sampling of the comments. My thoughts and prayers are out of network. Another, as they told me when they were denying to cover my medication, sorry for any inconvenience this has caused. And then there's this one. I can't seem to find the room to care over my daughter's $60,000 cancer treatment. Thoughts and prayers. Now, it should come as no surprise that people are mad at healthcare companies, very mad, and United Healthcare included. There are many horror stories of denied claims that have led to suffering for patients and their families. But there are some people, as we speak today, who are now openly celebrating the CEO's murder and even advocating for more death. One person writing, America needs to gun down about 50 more CEOs in cold blood before we can say we are actually progressing as a country. Is this really where we are with gun violence in this country? And in this instance specifically? Look, you can be mad at the system, all of its flaws, and the people who run it. That I understand. But advocating for murder as a way to solve the problem or seek revenge as a means of, what was the word? Progress? It's just wrong. Full stop. Stop. Joining me now, emergency medicine physician, Dr. Amy Faith Ho. Dr. Ho, thank you for joining. Are you surprised at all by just how dark some of the commentary has been around Thompson's death and, frankly, the healthcare industry more broadly?
You know, I wish I was more surprised. I'm with you. I do not think we should condone this. This is a tragedy. Someone has lost his life. But I'm an emergency physician, so I see people when they're at their lowest, when the system has failed them. And I'm frankly not surprised. They feel abandoned. They feel exploited. They feel lied to when it comes to the healthcare system, and especially insurances, because of the things you mentioned: denials, prior authorization, narrow networks, the cost of healthcare. It's been going on and bottling up for a long time.
We do bring people at their most vulnerable points down to their knees, and then money becomes a part of the healthcare process. We have talked about this for years, and you well know about this, but this just shows you, the celebration of a murder, openly advocating for more of it, and at that level, not of a healthcare provider, but the insurance industry, that takes it to a whole new level.
I think it's that people just feel so lied to. Healthcare is for the healthy and the wealthy, is the saying, and healthcare insurance was supposed to help make it more affordable and accessible. And so people paid their premiums. And when they needed healthcare to be there for them, they found that insurers were taking every tactic to not pay, because ultimately the insurance's fiduciary responsibility was to their shareholders and not to the patients. And that's the exploitation that I think patients feel. And then they're already in a situation where they're sick and they need care. And so you add that to the vulnerability, and frankly, they are just sick and tired, literally, of dealing with the system.
We don't know the motive behind this attack. We do know that there were certain words found on the bullet casings that reference common terms in healthcare grievances or the healthcare industry. But even if this motive is never identified in this way, do you think that this tragic incident is going to reshape the way the healthcare industry is responding to the anger?
I hope it does. I think the anger has been going on a very, very, very long time. I think United Healthcare is certainly one of the largest insurance companies, and frankly, one of the ones that's known for its denial rates and prior authorization and some of the other coverage comments that you've had. I hope it does show how badly we need a rehaul in healthcare. I do not think it should happen from the murder of individuals, but I think it really puts the onus on us and on congressmen to look at what is healthcare reform in America.
That's going to be the question for so many. We think of it this big umbrella term of healthcare, but the nuance, the devil in the details, how it impacts individual people, it's got to be a part of the conversation when there is this level of anger and response, and we are still wondering what the motive in this tragedy really is. Dr. Amy Faith Ho, thank you for your work in helping to bring attention to those who are suffering every hour of the day based on their own healthcare needs as well. Thank you.